Hello and welcome back to 21 Days to Symptom Free from IBS. It is day 2 and we were talking all about actually getting a diagnosis for your digestive symptoms. I just want to say, pat yourself on the back, give yourself a little congratulations for making it to day 2 and taking this time to learn about IBS and advocate for yourself. That's what this is all about, is helping you take control of your IBS and take back that quality of life. Irritable bowel syndrome, or IBS, is a frustrating diagnosis because oftentimes it is the diagnosis that results after testing and eliminating other GI disorders, because IBS shares a lot of symptoms and has a lot of symptom similarities with other gut conditions. So we'll talk a little bit more about ruling out those other conditions and red flags tomorrow. But how do you know if you have IBS? What is the diagnostic criteria? So although IBS can start at any age, it typically starts as a teenager or a young adult, and it can be found in both genders, but it typically affects more females. And you're likely to have IBS if a parent or sibling also has IBS as well. So the diagnostic criteria for IBS suggests that you might have IBS if you've experienced abdominal pain at least 1 day per week in the last 3 months, and if symptoms improve after a bowel movement or after a change in the appearance or number of bowel movements that you have, and if symptoms started at least 6 months ago. So if you checked off at least 2 of the above criteria, it's worth discussing with your general practitioner, your family doctor, or your gut dietitian for next steps. IBS can also be separated into 3 different categories, and these categories will be helpful for your gut dietitian to tailor your medical nutrition therapy specifically to you. So it's just a little about getting to know more about your unique symptoms. So in order to know what type of IBS you have, you'll have to become familiar with the Bristol Stool Chart. So give it a Google so that you can see a picture of it. But basically, here are some descriptions. Type 1 generally resembles like rabbit or deer droppings. They're separate little lumps, and they're pretty hard to pass. Type 2 is sausage-shaped but lumpy, as if you were putting all those droppings in type 1 together to form a sausage shape. So kind of like a bunch of grapes. Type 3 is sausage-like with cracks on the surface. Type 4 is sausage or snake-like. It's smooth and soft. Type 5 resembles little mini marshmallows. They're soft blobs, but they have clear-cut edges and they're totally easy to pass. Type 6 is not formed. It looks like fluffy pieces. It has ragged edges and it's a pretty mushy consistency. Type 7 is entirely liquid. It's diarrhea with no solid pieces. And it is never too much information for a gut dietitian to hear about your poop. It is need to know information. So listen to see which types that I'm going to talk about next best describes your bowel movements. So IBS-C, or IBS constipation, is described as having those type 1 and 2 more than 25% of the time, and having type 6 and 7 less than 25% of the time. And between those types 3 and 5 are considered normal. IBS-D, or IBS diarrhea, is described as having 6 and 7, so those type 6 and 7, those mushy or completely liquid with no solid pieces, more than 25% of the time, and having those types 1 and 2 less than 25% of the time. IBS-M mixed or IBS-A alternating, so this one kind of goes by two different names, is having types 1 and 2 more than 25% of the time, and having type 6 and 7 more than 25% of the time. So your homework for today is to have a look at the Bristol Stool Chart and pay attention to your stools to try and figure out which of these types best describes your bowel habits. And this is great information to have, and it's also going to be a little bit easier to do combined with your food, mood, and symptom journal homework from day 1. Thanks for being here, and tomorrow we'll meet same time, same place for day 3 to talk a little bit about red flags and those other gut disorders that commonly causes misdiagnosis. See you then.